It's a common problem for many men as they get older, but it could be a sign of medical problems if it happens to women.
After the break, we're talking about hair loss and the problems that thinning hair could indicate for ladies. Dr. DeRosa is here, and that is coming up here shortly. It is 8:14, and a lot of men deal with hair loss, but so do women. It actually, though, could be a warning sign for women, and Dr. Angela DeRosa is here to explain why some people have this problem while others do not, and some of the new ways to treat it. Good morning.
Good morning, and Happy New Year.
Happy New Year to you.
It's the first time I've seen you since
I know. It's so true. You say this is hormonal.
Yeah, usually hormonal, but hormonal is such a broad word.
Absolutely.
It can mean so many things. So when you're looking at hormone deficiencies in women that could lead to hair loss, it can be deficiencies in thyroid, which is the most common reason for hair loss in women, estrogen deficiency, testosterone excess, and we often think of testosterone excess in men causing baldness, but actually it's not the testosterone that's causing the baldness. It's actually when it converts to a more potent hormone called 5-DHT in the skin, which leads to acne and baldness in not only men but women as well. There's also some genetic component to hair loss. We often see medications. This time of year, everyone's going to be working on weight loss. So if you do it aggressively and very quickly, you will also lose hair during this time. Massive amounts of stress, which a lot of people are taking the stress relief right now. But also what we call idiopathic, and all that means is doctors are idiots and we don't know what's causing it. So that's a very broad term, but the most common top three: estrogen deficiency, testosterone excess, and thyroid, either too high or too low, with too low being more common.
How do we know, though, whether or not it's just, you know, a little bit of hair falling out in the shower or a real issue where we need to get treatment?
We all lose hair on a daily basis. And then when you look at the hair follicle cycle, it's 21 days. Every 21 days you make a new hair, and the hair that's old will fall out. But if you're coming out in clumps, or you're noticing very thinning here up in this region or in the crown, this is the testosterone excess problem here and here. But if it's overall thinning out or breaking at the ends and becoming very brittle, that's usually an estrogen deficiency or low thyroid or too high of thyroid. So the type, it's really the clumping. It's the degree of severity of the hair loss. So
if you've ever been through this, it can be horrifying.
It's especially for women, because we base our personalities on our hair.
Isn't it true?
Remember the big Alabama prom cream hair? God forbid, in the 80s.
Remember, I'm still trying to rock that look. Let's talk about some of the treatments. Hormone replacement, one of them.
Yes, certainly getting your hormones evaluated. Estrogen replacement, thyroid proper replacement, making sure it's not too high or too low. You can also use steroid injections if it's due to something maybe either genetic or the idiopathic variant, where you can inject steroids into the scalp or take them orally, which we tend not to like to do very often because that can cause other damage to the body. And also some people can do surgery, like the hair plugs for men. We can also do that from women, but most women don't typically do it because most often in women, it's a hormone problem, not idiopathic or other variant.
What's nice to know, though, Dr. DeRosa, is that there are options. I think so often, and I mean, we talk about that confidence issue. So often we feel helpless when our hair is falling out in large amounts, but when we know that there are options, it's just, it's alleviating.
Yes, it is, because we got to keep our beautiful hair. We got to rock the 80s, even though we're 2013 women.
Yeah, we're getting there. Your hair looks great. Thank you so much.